Hi everyone, very good afternoon to all of you. Myself Dr. Vachini Bhatt and I welcome you all in Friday Facebook Live. And today we have with us Dr. Pranav Shah, and sir is the head of Orthopedic Trauma Program at Marengo CIMS Hospital. Sir, welcome to the talk.
Thank you.
And sir, today's topic is very much curious and interesting, and it is a failed orthopedic surgery. I mean, this topic brings so much of curiosity in my mind, and I can put why, how, where, what, when, any of the WH questions to understand the detailing of this topic. So let's begin with the topic that what is this failed orthopedic surgery?
Yes. So, Vachini, orthopedic surgery or any surgery is done with an intention to create some amount of recovery.
Okay.
That is the intention. So, suppose there is a fracture and we do a surgery to heal the fracture.
Mm-hmm.
But when the fracture fails to heal, then that is a failed surgery and something else will have to be done.
Okay.
When it is done to treat an infection, but that infection is not eradicated, then you have to do something to heal that infection.
Okay.
So, that second surgery which is done, which is to reverse the ill effects of the first surgery, as well as to promote the healing or to achieve the result in the second surgery. That is a revision surgery.
Okay.
Revision surgery nowadays is becoming the talk of the town. It is becoming the epidemic because lot of surgeries are being done in probably not ideal environment, not in ideal infrastructure, and also not by ideal skills.
Mm-hmm.
And that is why we are not getting the 95 or 98% success rate that has been otherwise claimed.
Acha, okay. So that purpose which is not solved after the surgery, and that's why it is called as a failed orthopedic surgery,
Yes.
right? We cannot bring that 99% of the success rate.
Yes.
And so many factors are responsible for this failed orthopedic surgery. Then why it fails, sir? What is more detailing about that?
That's a very good question. See, we have to understand that orthopedic surgery is little different from other surgeries.
Okay.
Like suppose there is a patient who is having an appendix problem.
Mm-hmm.
You remove the appendix and the problem is solved.
Okay.
Suppose a patient is having a cancer problem.
Mm-hmm.
You remove that cancerous area and the problem is by and large solved.
So,
But in orthopedic surgery, suppose the patient is having a fracture
mm-hmm.
and you have done the fixation of that fracture.
Okay.
Then you have to wait for the nature to heal that fracture, which is a period of 6 weeks to 12 weeks.
Okay.
Now, in that 6 to 12 weeks, if anything goes wrong,
Okay.
in terms of the
Then-
patient being nutritionally not okay,
Acha.
in terms of the patient not taking adequate precautions, starting to weight bear early or not doing the exercises as
Mm-hmm,
advised,
mm-hmm.
or in terms of a poor quality surgery or poor quality implant where the fracture is not held in the position till it heals.
Okay.
Then with any of these factors at 6 weeks to 12 weeks to 3 months or 4 months, you will see that the fracture is not healing, the implants are loosening, the pain is increasing, and the patient feels that the surgery did not serve the purpose.
Acha. So negligence can be from either from the patient side or from the doctor side, which
Or
is not
from-
so severe, but then also it is
Yeah.
not so
So
successful.
negligence is probably a very harsh word. I would say that no,
It is
incompetence or I would say ill effect or some misunderstanding can be from 3 sides. So it is the body,
Okay.
which is much under control of nature, at the
Mhm.
same time under control of the patient in terms of his nutrition, his
Exactly.
alcohol and
so that
tobacco.
is also very necessary.
Yes, and then it also in terms of the infrastructure where the surgery was done, because you can see that sometimes in a poor infrastructure, the surgeries have very high infection rate.
Okay.
Now, once an orthopedic surgery gets infected,
Mhm.
the results will go from bad to worse, in the sense that if that patient was not operated and left alone to nature,
Okay.
he would still have got a better result than what he gets
Oh,
after
really?
infection. Yeah.
So prognosis can be better?
Worse. It can be worse.
It can be worse.
It can be worse with infection, worse
Okay.
than not doing anything.
Acha. Okay. Okay. I got that. So, sir, why these number are increasing of the failed orthopedic
Yes.
surgeries?
So that's something that lot of us have to introspect. See, there is a lot of competition in the market, right? Everybody wants to do a lot of surgeries, make a lot of money, move forward in life, feel successful. So somewhere in this competitive era, with government launching some schemes where there is a very limited budget and you have to do surgery,
Acha.
there is a very much cap on the implant and whatever you're going to put inside, because the government will give only X amount, or the insurance company may
Okay.
sometimes not agree to give Y amount,
full
which is
amount.
for a good implant.
Mhm.
So that cost cutting, which is
Mhm,
happening
mhm,
across
mhm.
in
Acha.
all the segments,
Mhm,
in that what happens is that somewhere the quality is compromised. That is the first thing.
Okay.
First thing is that the quality is compromised while doing the surgery.
Mhm.
So either a surgeon undertakes a surgery which is beyond his skill.
Okay.
Surgeon operates in a setup which is not ideal for that fracture. Or the surgeon will do it all ideally, but he does not use what is required inside because of the cost constraint.
Okay.
So in any of these three factors, we have given a slightly compromised output. Now, after that, the problem comes with patient. A patient, usually in my experience, a patient who is not ready to spend money for his own health is not going to listen to the instructions also.
Exactly. That is what I'm going to ask.
That is the patient's commitment to his own recovery, right?
Exactly.
I want to get a good recovery. I am going to spend X amount for my treatment. Insurance company pays or not is not the concern.
It is all about the health.
It is myself. It is my health. It is my priority. Now, if I am ready to compromise because the insurance company is not ready to pay, then I am also going to compromise in my post-operative care.
Exactly.
I will not call the physiotherapist at home for my exercises. I will not take the protein and vitamin and everything that the doctor suggested me to take. I will not go regularly for follow-up or for dressing. I will try to make a makeshift arrangement, call the compounder home and do whatever is possible.
Okay.
So all these levels where the quality is compromised, they add up. And ultimately what you get is a poor outcome.
They put the obstacles to the complete recovery and the success rate.
Yes.
I can understand. And sir, we received one message from the viewers, one question for us, that number of times you have used the word regarding the importance of the nutrition, importance of the physiotherapy for the better prognosis. Then how it is so important in the recovery or in the healing process after the orthopedic surgery? Which type of nutrition is very, very important in a general way?
Yeah. So see, from all surgeries, the recovery is very much dependent on nature. Okay. And nature requires certain building blocks to heal the tissue.
Okay.
So first is protein.
Yes.
All of our body, all the
Cells,
major factors, they are formed by protein.
Exactly.
So if we don't take adequate protein, then our healing is going to be compromised.
Okay.
It has been proved beyond doubt that a patient who is anemic, having a hemoglobin less than 8, their healing is compromised as compared to someone whose hemoglobin is 12.
Okay.
So the hemoglobin is important because it delivers the oxygen to the tissue which requires it.
For the healing,
Yes. Then the vitamin and protein, vitamin and calcium. Yes. So the bone healing is so much dependent on minerals. Okay, what is bone? Bone is protein plus minerals. If protein is the cement and minerals is the int, together the brick and cement becomes a structure. So that way, for the bone healing, you require calcium, you require phosphorus, you require all the trace minerals, and you require protein. Yes. All this in our vegetarian diet.
To the bones,
in our vegetarian diet, all this is lacking.
Yes, sir.
Even with non-vegetarian diet, you can see that there are a lot of, the food additives and the food, there's so much of problems with the healthy, nutritious food.
So, sir, we suggest any multivitamin or outside supplement, or
since the time that I started my practice, I have been using a multivitamin capsule for all my patients post-operatively.
So, compulsory for the better
from
healing?
A standard company like Glaxo. That medical representative has never met me. I have never seen, I have not even received a pen from that company. But the purpose is that, yes, economical, 1 rupee per day, economical,
it is providing
vitamin capsule along with calcium supplement is absolutely necessary for bone healing.
Okay, so that is very, very important, the role of nutrition and even the physiotherapy after the orthopedic surgery, right?
Definitely.
And sir, from your perspective, what are the challenges you have to face if the surgeries fail?
Yeah, so this is not only my perspective, also from the patient's perspective. You just imagine that somebody has just gone through a divorce and he has to remarry. What is his frame of mind? He has lost faith. He has lost faith in that entire institution. He has to rebuild the faith and undergo the same process, probably even a lengthier process, so that he can achieve recovery. So a person who has gone through orthopedic surgery, which has not given the results, sometimes they come with infection, with more problem, and now I have to convince him that I will not only treat your infection, not only remove everything old, but also do something new and bring you healing. That is a challenge for me, and that is a challenge for patient. Yes. And more challenging when the patient fully trusts and tells me, Doctor Sahab, aapke upar pura bharosa hai, aapko jo karna hai kariye. Now it is all on me. Yes. So now I have to take decision like his elder brother, that what I can do best for him. So in our hospital, we have fortunately, with the help of a very good proactive management, we have been able to procure whatever is necessary as an infrastructure. In terms of instruments, in terms of equipment, IITV, all whatever is necessary to undergo a complex orthopedic surgery. We have this procured from the day I joined this hospital. And because of that, at least from the infrastructure point of view, I am not facing any challenge.
Okay.
Second thing is from the other backup, like a patient who comes with this problem has lot of other medical issues.
Exactly.
So my team, our intensivist, our anesthetist, our physiotherapist, our cardiologist, they are so supportive. They will come, see the patient, counsel the patient, optimize the patient. Sometimes we take 2 to 3 days to make the patient prepared.
Yeah.
But we go in when the time is right.
Okay.
So fortunately, the ecosystem in this hospital has become so robust in dealing with this kind of patient that right from the nursing staff, the attendant staff, they all know what care is to be taken.
Okay.
And that is how that patient over a period of time gains more and more confidence.
Exactly.
So by the time he's discharged, he's very positive frame of mind that I'm going to heal this time.
Wow. And that is such a wonderful answer, sir. And what result can be expected from such surgery?
So this is one thing I want everybody to listen very carefully. A well done surgery will give you 98-99% success first time. But even better done surgery will give you less success rate subsequently.
Okay.
See, the bone and the tissues which have been violated once by surgery, if they are repeatedly violated by surgery, their healing potential gradually diminishes.
Okay.
So if I am doing a patient who has been operated 4 times previously, now the success rate is 80-85%.
Okay. So it is decreasing.
It is decreasing. Yeah. So my humble appeal to all the people who are undergoing this problem, okay, you please take 4, 5, 6 opinions before you undergo for the second time.
Okay.
Because the second time is, from my point of view, probably the last time that you get a success rate of 95.
Okay.
After that, your success rate is going to go down dramatically. Your quality of life is going to go down dramatically. Your psychological affection is going to be really bad. So anybody who has a failed orthopedic surgery, who has been advised to get it done again, he should not be in a hurry to do it. He should take multiple opinions. He should gain confidence. He should try to find out which are the centers which are dedicated to treat this, and then he should undergo the surgery.
Okay, I got that. Sir, does it require a different approach of setup or skills for surgeries?
Yes, it requires a lot of refinement of skills. Like I am now 30 years into my practice. So probably the first 10 years I was just doing primary surgeries. But when I started seeing complications, started operating them, I worked in corporate hospitals where all these complications come in. Exactly. Now, over 20 years, I can say that now I am skilled enough to treat that patient in internationally acceptable manner.
Okay.
But to reach that level of expertise, to reach that level of success requires a lot of dedication and lot of focus. So probably, in my opinion, there are different doctors who can do a revision surgery well, which are different from the routine doctors who do a primary surgery well.
Okay, sir. And if we talk about the infection, because we are talking regarding the surgeries and all that, so how we can prevent 100% of infection during the surgery and after that? So
you will be surprised to know that, there is not a single procedure or surgery in the world which offers 100% infection-free data.
Okay.
So the best results are with knee replacement and hip replacement, which give you 99 to 99.5% infection-free recovery.
Okay. And that
is the best results. Yeah. So we have to keep in mind that our fight with infection is a constant one, is going to remain. And if we are not careful enough, it's going to be worse. Probably in this 21st century, our data will show a 99 or 98 or 97% success rate because of the superbugs which are coming up. So a hospital which has a robust infection control program, where they don't allow you to use any antibiotic just like that. There are protocol-based use of antibiotics, rational use of antibiotics, proper timing and dose of antibiotics. If there is a hospital which is following this policy, you will see that those hospitals have a very less infection rate.
Exactly.
Because the cleanliness is at a different level, the disinfection is at a different level, the infection control protocols, everybody is sensitized to it, the hand washing is done so well. So patient has to choose a hospital with a very good infection control practices.
Exactly.
And that is only assurance he has of having a minimal risk of infection
to him, right, sir? And one question from my side, sir, because whenever we think, even being a doctor or even being a common people, whenever we think of orthopedic, we always think of physiotherapy. So how the physio is important in your branch?
You will be surprised that in my hospital, I operate today and my physiotherapist will see the patient next day morning. And the physiotherapist will personally call me from every patient's bedside what was done and what needs to be done.
Okay.
Physiotherapist is the one who actually brings confidence in the patient.
Okay.
See, the doctor claims कि मैं आपका आज सर्जरी कर दूंगा, कल आपको चलता कर दूंगा. But चलता
वो
डॉक्टर थोड़ी कर रहा है. That is the
physiotherapist.
physiotherapist. So the
Yes.
physiotherapist has to, when the physiotherapist meets the patient, he starts exercising the patient.
Yeah.
The patient starts to move the joint with minimum pain, and the patient is suddenly like,
getting back
yes,
to his routine.
I am better. And then the physiotherapist says, चलो खड़ा होने की हिम्मत है आपको? And the patient says, हाँ जरूर. And then patient is made to stand, made to walk. I have seen people with tears making videos, sending that videos in their WhatsApp group, because the result that they expected is given by the physiotherapist.
Oh, wow.
The promise is given by the orthopedic surgeon.
Exactly.
So I feel that my physiotherapist is like, my two physiotherapists are my right and left hand, and without them I am absolutely handicapped. Yes.
Yeah, I understand. And sir, one last question. What is your message to the viewers who are undergoing such type of surgeries?
So my message to the viewers is, your primary wealth is your health. And please don't compromise on that. Please don't try to cut corners when it comes to taking care of yourself, doing a procedure on yourself. Don't look at cheap alternatives. Cheap and best is a myth. सस्ता और अच्छा दुनिया में कुछ भी नहीं है. So, go to a good doctor, get a good implant in your body, get a good setup for surgery, and pray for the best. Thank you.
Thank you so much, sir, for joining us, and such a wonderful answer and understanding you have given to us. Thank you once again.
Thank you.